Okay, so this is going to be short, but sometimes the urinary system just cannot work appropriately. We need an alternate way to drain urine. So there are a few different options. They can go directly from the kidney. Let's find that image. This is usually not done on a long-term basis. This is usually a short-term option. This is a nephrostomy. It goes directly from the kidney into a drainage bag. That's all obviously a pretty serious infection risk. And so we need to make sure that it's getting really, really good site care. They can take the ureters and take them directly to the abdominal wall. So let's look at the ureterostomy. So the ureters go directly to the abdominal wall. That's going to need these are going to need an appliance. If this is going to be longer term, especially, they're more likely to direct both ureters together into one stoma, but they can go into separate stomas. Okay. We also may have what's called a continent urinary diversion. So these might be used if the bladder is no longer functioning or the bladder has to be removed. So let's look. So if the bladder has to be removed, a segment of intestine can be removed with it, can be removed as well, cleaned, and then used to form a reservoir. This is an ileal conduit. The ureters are directed directly into this ileal conduit. Now, it may or may not have a valve. If it does not have a valve, it's going to drain urine pretty constantly. If it has a valve, then it won't drain urine all the time, and the patient will be able to not wear an appliance and just catheterize this reservoir. Here's where this is the Coke pouch. This one is just a little reservoir and it's going to drain constantly. This one, a pouch is created, and this stoma has a valve so that urine can't flow out of it. And so a catheter can pass in and drain the urine. They also may create a neobladder. So go from the ureters to a neobladder. If the urethra is intact, this can actually be redirected to the urethra and this person could void normally. This just makes a new bladder. So one other option that I want you to look at is a suprapubic catheter. They're sometimes used for people who have obstructions in the lower urinary tract. Let me see if I can find a good picture of that. Here's an image. So let me unshare and reshare this. Okay, so a suprapubic catheter goes directly into the bladder. So if they have a lower urinary tract obstruction, then a suprapubic catheter can be placed. I have known patients who have permanent suprapubic catheters. They always have infections, always. I've seen them better used short term, but at times they're placed long term. Just be aware this is bypassing the urethra, and so this is an infection risk. So that patient will probably have chronic UTIs. Okay, so that's the end of the elimination section. It is fairly basic. You're going to get a lot more in-depth into Med-Surg next semester. This is a refresher. What do you remember from LPN school or fundamentals?